African Americans and other minority groups are being hit harder by the coronavirus right now. In other major cities across the country, death rates are climbing. Here in Minnesota, the numbers are better, but the disparities still exist. Fox 9's Christina Palladino is live for us tonight with more on that. Christina?
Absolutely. Health professionals are very worried about the access to care for people of color, as well as how they are treated by healthcare workers. As you said, here in Minnesota, we are doing slightly better than in other states, but we are far from equal.
Injustice in the healthcare system is the most shocking and inhumane, right? And we didn't take heed to that warning. And so that's exactly what we're seeing right now. Why the African American community is being disproportionately impacted by COVID-19 is because of institutionalized racism. Right?
Leslie Redman, the Minneapolis chapter president of the NAACP, is worried about how the COVID-19 pandemic is impacting her community. In other major cities across the country, African Americans are dying at an alarming rate from COVID. Here in Minnesota, the picture is slightly better. Recent data shows whites are about 84% of the population and 73% of the coronavirus cases and 88% of the deaths. Minorities are a disproportionate number of cases. However, death rates are not as high.
And it's really during pandemics like this that these really get highlighted in very real, sobering ways that are disappointing, to say the least.
Dr. Mark Steffen is the chief medical officer at Blue Cross and Blue Shield of Minnesota. They have at least 300 clinicians working with people in underserved communities in the area. Lack of access to health care, unfair treatment by healthcare workers, and underlying health conditions are some of the major reasons behind the disparities.
We've really set up a system that revolves around the traditional populations that have existed within our state, within the nation, and that demographic is shifting rapidly, and our healthcare system needs to shift and change rapidly with that.
African Americans and other minority groups are also less likely to be able to work from home, and they rely on public transit more. Community leaders say they need better resources to adapt to our changing society.
We live in food deserts, right? Our community hasn't had access to a number of things that we need.
And there are several clinics in underserved communities that are trying to be proactive and help disadvantaged people stay healthy during this crisis. Randy and Kelsey?